Post-operative instructions, general. Extractions. Bleeding. Leave the gauze pad over the area of surgery for about 60 to 90 minutes. Hold it in place over the surgery site by biting on the gauze with mild pressure. You may change and replace the gauze as needed every 20 minutes. Avoid constant spitting or rinsing of your mouth in order to not interfere with clot formation. A clot should form within a few hours, after which you may gently remove the gauze pad and then use only as needed if bleeding recurs. Some oozing is normal for a few hours after surgery. Should the oozing be persistent or heavy, first rinse your mouth out thoroughly with warm water and remove any visible clot sticking out of the socket with a gauze pad or Q-tip. Place a gauze pad soaked in a strong tea solution directly over the bleeding area and apply pressure. Apply continuous pressure for 30 minutes until the bleeding stops. If bleeding still persists, then contact us at our office or through the paging service. Try not to smoke for a period of 5 days after your surgery. Remain quiet the day of surgery, get plenty of rest, and do not engage in strenuous, dangerous, or physical activities for 3 days after your surgery. Pain. If you are given a prescription for pain, have it filled immediately and follow directions, which will be on the label of the container. If prescribed anti-inflammatory medication, Advil, Motrin, ibuprofen, Lodine, Cataflam, etc., it should be taken right away. Narcotic medication, codeine, Darvocet, Vicodin, hydrocodone, should be taken only if the anti-inflammatory medication is not properly relieving your pain. If you do require the narcotics, you can use them in addition to your anti-inflammatory medication if needed. Do not take medication with an empty stomach. If the pain medication seems to cause nausea or vomiting, then discontinue its use and try using a non-prescription pain medication such as Tylenol, Advil, or aspirin. If these do not provide adequate pain control, or if nausea and vomiting persist, call us. Remember that the most severe discomfort is usually within the first 8 hours of surgery. After that, your need for medicine should lessen. Do not operate dangerous items, machinery, or engage in dangerous work while taking pain medication. Do not drink alcohol or drive while taking pain medication. Swelling. On the day of surgery, keep the face cold with periodic use of ice packs, 20 minutes on and 20 minutes off. On the day after surgery, start using warm salt water. Half teaspoon of salt in a glass of warm water as a gentle mouth rinse after every meal and also between meals. Start brushing your teeth the day following surgery. A continued increase in swelling after the first 48 hours or elevated temperature following surgery should be assessed, so please call our office. If you were prescribed an antibiotic rinse, chlorhexidine, start using it on the evening of surgery. Follow the instructions on the bottle and use for 8 days only, unless specified otherwise by your doctor. Diet. Immediately following surgery, liquid or soft foods are recommended initially. As soon as you can, start a solid diet. Sustacal, Carnation Instant Breakfast, Meritini, Nutriment, or Ensure are helpful when used as liquid snacks. Soups and plenty of fluids and daily vitamins are also valuable. Do not eat very hard foods, such as rock candy, for about 8 weeks. Sutures. If stitches were placed in your mouth, it was to prevent excess bleeding and help hasten the healing. These will be removed easily and painlessly on your appointed day. Do not be alarmed if they become loose and a nuisance. Sometimes, dissolvable stitches are used and do not require removal. However, they may take several weeks to completely dissolve. Infection. If you were given a prescription for an antibiotic, the directions must be followed closely. Infection can be a serious problem, and your antibiotic should treat and prevent infections. If you were prescribed an antibiotic rinse, please start it on the evening of surgery. Dry socket. A dry socket is a delayed healing of the socket. Symptoms include a dull aching pain in the ear, chin, adjacent teeth, or jaw, beginning on about the 3rd or 4th day after surgery and lasting an average of about 10 days. If pain medication does not satisfactorily control the symptoms, please notify us. Frequently, a medicated packing can be placed in the socket to alleviate the pain. This packing will need to be changed every 3 or 4 days until healing is complete. Miscellaneous. If a denture or other prosthesis was inserted following your surgery, do not remove it for 24 hours or until you have been seen by us or your family dentist. In some types of surgery, particularly surgery of wisdom teeth, a numbness may be experienced for days or even weeks after surgery. This is usually temporary and should gradually disappear. Ask us when you can resume contact sports. If you have had sedation or a general anesthetic, you should not drive a car or operate dangerous equipment for the remainder of that day and night. The friend or family who accompanied you should review your instructions with you and stay with you for 6 hours after your departure from the office. If you have any questions, concerns, or problems, you may contact the doctor on call by phoning the office or, after hours, call our paging service at 217-241-8606. If you do not receive a response within 30 minutes, please call again.